Patients aren't alike, we know that. What works for interacting with one might not work for another. Providers have to talk with each of them differently, take different approaches to each of them depending on that patient's knowledge, skills, and confidence. Their patient activation, we call it. It's a quality that's being measured right now by the PAM, or the Patient Activation Measure. Well, just like patients aren't alike, providers and clinicians are different too. They come to their patients with different skill sets, different expectations, different strengths to help them along in their journey. In fact, if you look at clinicians closely, you can see that they're not as alike as they might appear at first either. That's where the CAM comes in, a clinician activation measure that Fairview's studying to see how it relates to our patients' PAM scores. We're asking all the staff that interact with patients to do a CAM to see how it eventually relates to our patients' PAM.
What the hell's this? The PAM?
Oh, yeah. Well, this is PAM. This is what's called patient activation measures.
What's a patient activation measure?
Well, I tell you, patient activation, Dave, is when patients have the knowledge, skills, and confidence to adequately manage their health. And we use the patient activation measures survey, which is a 13-question survey that we have patients take to evaluate their level of activation. Dave, what is this? The CAM? We just had the PAM. What is the CAM?
Well, Jamie, the CAM is a lot like the PAM, but it's for clinicians.
Oh.
It's basically a way that we can find out how clinicians interact with their patients to support activation.
Oh, interesting. So we would, as clinicians, we would take this survey tool to get a sense for our activation levels.
Exactly. In fact, it's on SurveyMonkey.
Interesting.